Hello everyone, welcome to Nursing Guru. Today I am back with one more episode of microbiology subject, that is immunity. Have you ever wondered when we fall sick, what is the mechanism that is helping us in the defense in the organism? Yes, that is immunity. Let's get started. In this video, we will be able to study immunity, types of immunity, hypersensitivity reactions, antigen antibodies, vaccines. Okay, let's get started. Immunity definition. It is a resistance developed by the host cell to fight against any pathogenic microorganisms. Classification: innate immunity, acquired immunity, local immunity and herd immunity. Coming to detail about that. Innate immunity. It is the resistance developed by the host by birth, that is inherited. It is the first line of defense developed by the host cell. There are two types of innate immunity. One is non-specific immunity and specific immunity. Acquired immunity. It is the resistance developed by the host cell during his lifetime, that is after birth, by selectively eliminating the foreign molecules. There are of two types, that is active acquired immunity and passive acquired immunity. Active acquired immunity. Active acquired immunity is a type of acquired immunity where there is resistance is developed by antigen stimulation. These are also two types, that is natural and passive. Natural active immunity and passive active immunity. In natural active immunity, it is a kind of resistance developed by after clinical exposure or clinical illness. For example, patient developed a natural active immunity after exposure to smallpox virus. Coming to artificial active immunity, it is a type of active immunity where there is injection of vaccines, that is resistance developed by administration of vaccine. These vaccines are of two types, that is live and killed vaccine. For example, for a tuberculosis patient, you give BCG as a vaccine that acts as a artificial active immunity. Passive immunity. Passive immunity is a type of acquired immunity where resistance is developed by outside the body, that is artificially or ready-made form. Even it has two forms, that is natural and artificial. In natural, immunity is resistance immunity or resistance developed by the host cell by mother to fetus, that is during the breast milk. In artificial, there is administration of antibodies. For example, hyperimmune sera of animals. Local immunity. It is a type of immunity where live vaccines are administered orally and immunity is developed at the site of entry or administration. IgA plays a very important role in this immunity. Last one is herd immunity. As the word herd means community. It is immunity developed in the kind of community, like one particular place or people. Example, epidemic diseases. Hypersensitivity or oversensitivity. It is undesirable reaction developed by the host immune tissue or cells. There are four types of hypersensitivity reactions: type 1, type 2, type 3 and type 4. Type 1 is called immediate hypersensitivity reaction. Type 2 is called antibody dependent. Type 3 is called immune response. Type 4 is called late or delayed type of hypersensitivity reaction. Now coming to immunoglobulins. Immunoglobulins are also called as antibodies. They are Y-shaped structure protein molecules, helps in neutralizing or detection of foreign molecules. There are 5 types: immunoglobulin G, immunoglobulin M, immunoglobulin A, immunoglobulin D and immunoglobulin E. Structure of immunoglobulin. They are heterodimeric in structure, contains of 2 heavy chains and 2 light chains. They have variable domains which helps in antigen attachment. These variable domains are again contains, in heavy chains you have 5 domains and in light chain you have 2 domains. Antigen antibody reaction. It is the interaction between antigen and antibody is called antigen antibody reaction. This antigen antibody reaction helps in detecting disease causing agent and helps in prophylaxis. Types of vaccine: live or attenuated vaccine, inactivated vaccine, toxoid vaccine, subunit vaccine, DNA vaccine, conjugate and recombinant vaccine. Cold chain. Cold chain is a system of transporting and storage of vaccine from the time of manufacture to the time of point of administration. It has two components, equipments and the person who handles it. Coming to the person, only one person, assigned person should handle it, and there should be one backup person for it. And equipment should always be have a recommended temperature as per the protocol of WHO, and cold boxes should be carried along with the vaccines. Equipments, while coming to the equipments, these vaccines are carried in these equipments with a recommended temperature box. Coming to the storage and handling of vaccines, storage should be done only on the protocol temperature. Adequate electricity should be maintained. Two refrigerators should be used, that is different doors for refrigerators, vaccines and the freezing vaccine. Dome style doors of refrigerator should not be used. Assign the responsibility to one person and backup person should be available. Open only one vaccine at a time, never use the half used vaccine bottles, and store the MMR varicella vaccines until they are ready to use. Heat and cold sensitivity of the vaccine should be noted and recorded according to it, and or stored according to it. Large enough to store year quantity of vaccine. Store only biologicals, like you should never mix the food or beverages with the vaccine, they should be kept separately. Lastly, serology. Serology is nothing but the blood test. It is a test which helps in determining the illness of the body by detecting the level of antibodies in the blood. For example, if you take dengue patient, if you go for a dengue serology test, you will find an NS1. By the presence of NS1 antigen, you can make out the person is ill for the dengue or not. Immunization schedule. It is a schedule developed by the WHO for the persons to get vaccinated to a particular disease. It starts from soon after the birth. Babies are given BCG, oral polio and hepatitis B vaccine soon after the birth. Later on, they get vaccinated for MMR, DPT and hepatitis along with their booster doses according to the WHO recommendation. Thanks for watching the immunity topic. Hope it helps in everyday day-to-day activities and learning very easily. If you want to learn more videos about more subjects, download the Nursing Guru app and makes it very easy. Thank you.